Hello everyone and welcome to your Muscles Lab List lecture. And this is just going to be part one. I'll be going through all of the muscles that you'll have to know for chapter 10, and also these are all the ones that will be fair game for your practical exam one. So let's get started. The first group of muscles we're going to talk about are going to be your back muscles. And you'll see on your list that I've divided these into excuse me, into your muscle's name, the action, and when I say action, that is what this muscle is able to do to your body when the muscle contracts, when it shortens. And innervation is the nerve that goes over to supply that muscle, to allow it to contract. So, like I said in class, majority of these I'm going to have you cross out. On this particular list, I'm having you leave the innervation for trapezius, but these other four muscles, you want to write branch of the brachial plexus. So our first muscle is the trapezius, and this muscle is very much kite-shaped. So if you can imagine it on the other half of the body, the right side of the body, you would see a kite shape. Also in this screencast, I've listed the origins and insertions. Let me just quickly explain what that is. The origin is going to be the area where the muscle attaches that has no movement. So in this case, it's the skull, the cervical vertebrae, thoracic vertebrae, and then the insertion is where the muscle attaches, where the actual movement will occur. So in this case, it's the spine of the scapula, your acromion, and then this muscle wraps anteriorly to insert onto the clavicle as well. So the action of our scapula is to elevate and depress and adduct the scapula. So what I want you to do is take your right hand and put it on your left shoulder, and I want you to elevate your shoulder. So elevate your scapula. So basically you are shrugging your shoulder on up, and you could probably feel, if you still remember these bone markings, your spine of the scapula, your acromion, and your clavicle are all lifting together as you do this, and trapezius is the muscle that's assisting us in doing that. The innervation here is going to be cranial nerve number 11, which is an accessory nerve. This is one of those special muscles that gets innervated by a cranial nerve. All of the other cranial nerves are really within the head, except for the vagus nerve, which is cranial nerve number 10. We'll get into that next quarter. But I wanted you to know this one because it's a special one. And then when we get into the nervous system, you could cross this one off your list. You're going to say, I already know this one. And here's that kite-shaped muscle, the trapezius. I just wanted to give you another view. Next we have Latissimus Dorsi, and it looks like, I'm just going to shift this over, it looks like my transfer over didn't look too great. So Latissimus Dorsi is this muscle down here that's blinking. This is also called the swimmer's muscle, and it is going to originate from the thoracic and lumbar vertebrae down to the sacrum, and then it curves over the iliac crest and inserts onto the intertubercular sulcus of the humerus. Remember, you do not have to know the origins and insertions for your theory exam nor your practical exam. I'm just giving you these so you kind of understand the attachments and understand the location of the muscle a little bit more. Now the action of Latissimus Dorsi is going to be adduction, extension, and medial rotation of the arm. This makes sense that it's on the arm even though it's a back muscle because the insertion is on our humerus. And innervation, I know it says thoracodorsal nerve, but we're going to go with the branch of the brachial plexus. Now the other three muscles left on our back are going to be Levator Scapulae, Rhomboid Minor, and Rhomboid Major. So let's look at those next. We have Levator Scapulae here, and I always think Levator Scapulae sounds like elevator, right? So we start at C1 and we take the elevator to C4, okay? And then all of these are going to insert on the medial border of the scapula, but they're at different areas according to the spine. So this one happens to be above the spine. The action is to elevate the scapula. So what a perfect name for a muscle. Levator Scapulae, and the action is to elevate the scapula. And innervation I want you to know as branch of brachial plexus. Next we have Rhomboid Minor, and this is a teeny muscle. It originates from cervical vertebrae 7 and thoracic vertebrae 1. And it's going to insert at that medial border of the scapula at the spine. And action is adduct scapula. So you're bringing your shoulder blades closer together, closer to the vertebral column. And the innervation I want you to know as the branch of the brachial plexus. This is like a little mnemonic that I used, Nintendo DS, to memorize dorsal scapular nerve, but because we're not memorizing that nerve, don't worry about it. Next we have the rhomboid major muscle, and this is the larger one below rhomboid minor. This originates from vertebrae T2 to T5. Insertion is medial border this time, but below the spine of the scapula. Action is the same as minor to adduct the scapula, and innervation I want you to know as branch of the brachial plexus. So throughout our lectures, I want you to always remember that major muscles usually almost always hold up minor muscles. So just like we saw back in here, this major muscle is holding up the minor. Okay. All right. What is this muscle here? If you said trapezius, you are correct. This one? If you said Latissimus Dorsi, you are correct. Okay, let's move into our chest muscles. So once again, cross off the innervation. I want you to know these as branch of the brachial plexus. So first up is the pectoralis major muscle. This is originating from the clavicle, your sternum, and costal cartilages that would lay below here 1 through 6. The insertion is at the crest of the greater tubercle of the humerus, and when these muscle fibers contract, it is going to adduct, medially rotate, and flex the arm. And I'll be demonstrating some of these actions in class, but what I want you to do right now is stick your left hand underneath your right armpit, and I want you to flex your shoulder, okay, or flex your arm at the shoulder joint, and then adduct and also medially rotate your arm. So when you do this, you can feel a very prominent tendon underneath your armpit and anteriorly, and that's going to be the tendon of pectoralis major. And innervation, known as branch of the brachial plexus. I just wanted to show you, remember that the costal cartilages are those hyaline cartilage pieces that are attaching the ribs to the sternum. So the pectoralis major is laying right over these costal cartilages, 1 through 6. Next we have pectoralis minor, and in order to see this, we had to cut pectoralis major out of the way, and we see pectoralis minor here. This is originating from ribs 2 to 5, but you might see some variation in the lab. You might see 3 to 5 or 3 to 4. It just varies with bodies, but this is the most common, ribs 2 to 5, and it inserts into your coracoid process. So because it's attaching here to a structure on our scapula, we know that's where our action is going to take place. It is going to depress the scapula, and I always kind of remembered this because I was like, oh, poor pec minor. It is just always covered up by big old pectoralis major. So it's depressed, hence depression of the scapula. And innervation is branch of the brachial plexus. Next we have serratus anterior. This is one of my favorite muscles. I think it's so cool. It originates from ribs 1 through 8. So you'll see this muscle just jumping up onto each of those ribs, and that's what gives it a serrated appearance, like a serrated saw. And its innervation is the medial border of the scapula. So it's actually going to wrap around to go underneath the subscapular fossa in order to attach to that medial border of the scapula. So let me explain this in class, or in lab rather, on one of our skeleton models so you really understand the direction it's going. And based on that attachment, it allows upward rotation of the scapula, which I'm going to show you what that motion is on the following slides. And innervation will be branch of the brachial plexus. So here's a nice little view of that wrapping around. We have ribs 1 through 8, origin here, and then it's going to go underneath. This is the anterior part of the scapula here. We see the spine, part of the spine back in here, and it's attaching to that medial border. So sometimes the scapula is orientated outward and backward when we have a weakening of the serratus anterior, and so we can call this a winged scapula. And the reason for this is usually we have some type of impingement or pinching of the long thoracic nerve, which is the specific nerve that innervates this muscle. So we have destabilization and causes the scapula to slip away from the rib cage. This muscle is really helping it to stay in place, and also it'll allow us to do upward rotation of the scapula. So when we raise our arm, raise your arm to about the shoulder level. You will get a collision between your greater tubercle here on the humerus and your acromion. So we need to rotate the scapula a little bit more so we can raise our arm up above our head. And so when we sometimes have patients that undergo a mastectomy and their surgeon accidentally severs the long thoracic nerve, cutting off supply to the serratus anterior muscle, the patient is not able to lift their arm up higher than the shoulder level. So we say at least they can raise their arm up high enough to point out that surgeon in court. I couldn't find a woman, so this guy is going to have to do. Next, we have our shoulder muscles, and once again, cross off the innervation portion and right branch of the brachial plexus. And you can see I put stars on these 4 muscles here. These are your rotator cuff muscles, which we'll talk about next. So we're going to start off with the deltoid, and this is that triangular shaped muscle on our shoulder. So think delta, like the delta triangle. It's the deltoid shape. And this originates from what I like to call sac, spine of the scapula, acromion, and clavicle. So it's that same place where trapezius is inserting. It's just trapezius is inserting above, deltoid is originating from below. And insertion is going to be that special place on the humerus, deltoid tuberosity, and the action is to flex, extend, medially and laterally rotate, and abduct the arm. So almost every type of action you can have at the shoulder joint except for adduction. And innervation is branch of the brachial plexus. Next we have supraspinatus, and this originates from that supraspinous fossa we learned about. And it's going to insert into the greater tubercle on the humerus. So we don't really see that insertion here because it's going below this spine of the scapula and acromion to get there. It's going to abduct the arm. That makes sense because it's coming in, here's my origin, and inserting from above. So when this insertion, when this muscle contracts, the insertion always moves toward the origin. So when we pull this insertion toward the origin, it's going to lift our arm up to abduct. And innervation is branch of the brachial plexus. Here's just a closer view of the supraspinatus. And now you could see a little bit better how that insertion into the greater tubercle takes place. Infraspinatus is found at the origin of the infraspinous fossa, and it too is going to go and insert into the greater tubercle. Its action is different though because its origin is at a different place. So we pull that insertion closer to the infraspinous fossa and we get lateral rotation of the arm. And its innervation is the branch of the brachial plexus. So in this view, you can kind of see a little bit better. Here's my infraspinatus muscle inserting into the greater tubercle. Now we have our teres minor, and teres minor is this little guy over here, and it's originating from the lateral border of the infraspinous fossa. Sorry, I got 3 S's in there, I just realized. And the insertion is the greater tubercle. So almost all of these rotator cuff muscles are inserting into the greater tubercle, and its action is going to be lateral rotation of the arm as well, same as infraspinatus. And the reason for that is we have a similar origin and same insertion. So same action. And innervation is branch of the brachial plexus. So here's another view of our teres minor, and you can see it's really a small muscle inserting over to the greater tubercle as well. Next we have subscapularis, and this one is the last one of our rotator cuff muscles. It's going to originate from the subscapular fossa, and that's why we have this anterior view of it. And it wants to go over to the greater tubercle, but there's just no space left. So it's going to go over to the lesser tubercle, which is located more anteriorly anyway. So it's just perfect. And now we have a little bit different line of pull, so we're going to do the opposite here and go for medial rotation of the arm. And innervation is the branch of the brachial plexus. And here's another view of that subscapularis muscle inserting into that lesser tubercle. What's this muscle here? If you said supraspinatus, you are correct. This one here? If you said infraspinatus, you are correct. This muscle here? If you said teres minor, you are correct. And this is just a little bit different view of our rotator cuff muscles. It is a lateral view, so you can really see how each of these rotator cuff muscles are rotated around the head of the humerus or your shoulder joint. So the way we remember your rotator cuff muscles is by the mnemonic S.I.T.S. And this goes a little bit further because you can think you can sit on the greater tubercle, but you cannot sit on the greater tubercle. So if we were memorizing insertions, you would know that S.I.T. here, supraspinatus, infraspinatus, and teres minor all insert on the greater tubercle, but the subscapularis does not. It's going to go and insert onto that lesser tubercle. So we just have teres major left, and that's going to be located right below teres minor. Its origin is the inferior angle of the infraspinous fossa, again 3 S's, sorry about that, and insertion is just a little bit lower at the crest of the lesser tubercle. So because of the change in the line of pull, we could do medial rotation and adduction of the arm here, and its innervation is the branch of the brachial plexus. So here's just a little bit different view. You could see your supraspinatus here, infraspinatus here, teres minor here, and teres major down in here. Oh, I forgot I had these labeled. And there's our teres major. Whoops. So you want to notice that this is also moving a little bit more anteriorly. It starts here on the posterior surface of the scapula, but then it moves anteriorly below. This is a tendon of our, this is one of the heads of our triceps in order to make it to that crest of the lesser tubercle. So you'll notice that some of the muscles we're discussing all share similar actions. So I wanted to kind of put this in perspective for you guys. And looking at the humerus here, we have your pectoralis major inserting at that crest of the greater tubercle, your latissimus dorsi inserting at the intertubercular sulcus, and the teres major inserting at the crest of your lesser tubercle. So once again, you don't have to know these insertions, but I just want you to think about this a little bit as far as how these muscles work. And so you see that all these are lined up right next to one another. So they are all going to adduct and medially rotate. They're all doing those same functions because they are inserting at similar places. The only difference is pectoralis major is anterior, so that is also going to flex the arm. Latissimus dorsi is posterior, so that is going to extend the arm. And teres major is just a small muscle, so it has no additional action. Now let's get into the arm. We are going to talk about our posterior arm muscles and anterior arm muscles. So really your, and I should have moved this up a little bit, but your triceps are the only muscle you're going to have on your posterior arm. In your anterior arm, you have your biceps, and this should be shifted because your long head and short head belong to your biceps brachii. And then you have your coracobrachialis and your brachialis muscles. So starting off with the triceps on the posterior arm, you have your long head, your lateral head, and then we have to peel away a layer in order to see your medial head. So your long head is in place here. We cut away your lateral head. So these are the pieces of your lateral head left, and we could see your medial head. So let's go back to this view here. And let's talk about your long head first. It's going to originate from the infraglenoid tubercle. So we don't really see that origin here because it's hidden underneath those other muscles. Your lateral head originates on the humerus above the radial nerve. Now, if you're like, what is this radial nerve? It is right below the lateral head. So let me pull this away real quick. So when we cut away this lateral head here, you can see this radial nerve. And this radial nerve is the one that innervates this muscle, okay? So what we're left with is your medial head, and this is originating from the humerus below the radial nerve. And all of these will insert into the olecranon process, or your elbow. So when we contract this muscle, it is going to extend our forearm at the elbow. And from now on, these innervations that are listed are ones you should know. So this is innervated by the radial nerve. And this is just a view of this radial nerve. So it's coming off of your brachial plexus as well, but it's more of the terminal branches. So we'll get into that more in the nervous system. But, whoops, sorry about that. But this radial nerve is extending down the posterior side of your arm as well as your posterior forearm. So it supplies all of those muscles, posterior arm and posterior forearm muscles. Next we have your biceps brachii, and by the way, bi means two, sep means head, and brachii means arm. So this is a two-headed muscle of the arm. So that would make your triceps your three-headed muscle of the arm, right? So first we have our long head, and there's your short head. Now you might be thinking like, okay, Mrs. B, this doesn't make sense. Why is the long head short and the short head is long? But the reason for this is this long head that you see in green actually continues up into the shoulder joint to originate at the supraglenoid tubercle. So it in actuality is longer. And the short head, I don't know why my origin got deleted here, but it's going to originate from the coracoid process. Then both of these heads go and insert into the radial tuberosity on the radius. And its action is not only to flex the forearm like most of us know, but it's also to supinate the forearm. So it's kind of that lateral rotation of the forearm as well. And this, along with all the other muscles in the anterior arm, are innervated by the musculocutaneous nerve. Next we have Coracobrachialis. This is one of my favorite muscles because it's easy to identify for me. I can always tell because 88% of the time we have the musculocutaneous nerve piercing this muscle. It's going to originate from the coracobrachialis, and then it inserts into the middle medial humerus. Its action, it's a small muscle, so it's only going to flex the arm, and innervation is the musculocutaneous nerve. So if you were, this is saying how 88% of the time the nerve pierces this muscle. But if you were having a hard time and you wanted to memorize the insertion of coracobrachialis, I always remember coracopuffs. So is for your middle medial humerus. Middle medial humerus, there it is. Okay, and lastly we have your brachialis muscle. This is originating from your lower humerus, and it inserts into the coronoid process of the ulna. So you can see this tendon over here. That would be the tendon of biceps brachii, because it's inserting into that radial tuberosity. So coronoid process of the ulna for the brachialis, radial tuberosity for the biceps brachii. The action of this is going to be flex the forearm, and this is because this muscle is crossing your elbow joint. Whatever joint you're crossing, that's the joint it's working on. So like when we look up here at coracobrachialis, it's crossing the shoulder joint and inserting onto the arm. So that's where its action is. It's going to flex the arm at the shoulder. Whereas brachialis it's going to flex the forearm at the elbow. And innervation is musculocutaneous nerve. This muscle is also, I want to mention, found deep to biceps brachii, so that's why we're only seeing that small tendon here because we've cut it out of the way. Next, we have muscles of facial expression. So first we'll start off with Procerus. And Procerus you can find right in between your eyebrows, and it's that wrinkling that you do between your eyebrows when you come home too late from your curfew that maybe your father is looking at you like this. And it also creates those lines. Usually women, or I shouldn't say women, all people get Botox later in life to fight these wrinkles here. Next, we have Zygomaticus major and minor, and both of these muscles are going to assist us in smiling. Next, we have Orbicularis oris, and anytime you see that word orbicularis, it usually means it's going to be a circular muscle around a structure on the face. So here we have, and oris of course means mouth. So this is going to allow us to do the kissy face, pucker up, or duck face, as is popular in selfies. And next we have your Orbicularis Oculi, and in this case, oculi is referring to the eye. So we actually have two parts of this muscle, a palpebral part and an orbital part. We use the orbital part just to close our eyes like this, like when we're blinking. But if we really need to shut our eyes tight, then we are also using the palpebral part, which means eyelid. Next we have the buccinator, and this is the buccinator here. It's actually like a rectangular muscle, but we're soon going to learn sitting over it is another muscle called Risorius. So this is what the muscle looks like in actuality, and this is going to allow us to do things like blow a trumpet, or for infants to suckle milk. And then we have platysma, and this is a subcutaneous muscle. So when we try to contract platysma, it just lifts the skin on our neck. Next we have Risorius, and this helps move our corners of our mouth laterally. So it depends. Sometimes your Zygomaticus major and minor are going to assist you in smiling with this curved up fashion. It kind of pulls it up at an angle. And for other people, the Risorius muscle is a little bit stronger and they smile more in a straight fashion. Next, we have muscles of mastication, and these are all innervated by the trigeminal nerve, which is also cranial nerve number 5. So I've divided these up based on action. So the first action we're going to talk about is elevation of the mandible. So here we have the temporalis muscle, and you can see it's right over the temporal bone, but it's going to insert itself onto the coronoid process of our mandible. And then I had it cut away in this image, but when we switch to this one here, you could see your masseter muscle here, and it wraps itself around the angle of the mandible in order to help elevate that mandible. Next, we have your grinding movement of teeth. So that lateral excursion to the right and to the left is what these lateral and medial pterygoid muscles assist us in doing. And as you might be thinking, yes, these are attaching to those plates of the pterygoid processes on your sphenoid bone. So this is a view of your lateral pterygoid, and this is a view of your medial pterygoid. Next, we have a neck muscle for you, and I've mentioned this one in class before. This is your sternocleidomastoid muscle, and it's named based on its attachments. So from the sternum to the clavicle to the mastoid process. So quite a thick muscle, and this assists us in turning our face to the opposite side. And also when we contract both of these muscles on the right and left at the same time, it's going to allow us to flex the neck. And its innervation, it's the same as trapezius. There it is again, cranial nerve number 11, the accessory nerve. And I just wanted to show you some of the vasculature here. We're going to talk about this in our cardiovascular system, but here's our sternocleidomastoid muscle, and then sitting next to it is going to be your internal jugular vein and your common carotid artery. Now we have our, that should say deep muscles of the back. Sorry about that. We have erector spinae, and this on your lab list, it for some reason got my lining wrong, but erector spinae is made up of three separate muscles. We have iliocostalis, longissimus, and spinalis, and then two other deep muscles are your splenius and your multifidus. So erector spinae is, like I said, made up of iliocostalis, longissimus, and spinalis. Iliocostalis is named so because it originates from the ilium and then inserts itself onto the costals, the ribs. Longissimus is the longest of all of the erector spinae muscles. And then number 3 here, spinalis, that is the closest to the spine. So the way we're going to remember this is I love spaghetti, because who does not love spaghetti, right? So I for iliocostalis, love for longissimus, and spaghetti for spinalis. And these muscles start dividing at the level of T12. So that is at this level right here. Below this area, we would just call this erector spinae, because it's where all of their tendons kind of merge together. And then we also have splenius here, and this is going to assist us in extending our neck. And we also have the multifidus muscle, and this is a very deep muscle, and they're the most developed in the lumbar area, and it's going to assist us to twist our spine. Like, you know that dance from the 50s, I think? It's called the twist, maybe? Yes, no? If not, YouTube some videos. All right, so that is going to be it for this first part of Chapter 10 Muscles Lab List. I hope this helped, and we'll discuss these in lab.